All right, well, good afternoon. This is March 21st, a 2:30 briefing from St. Lucie County Emergency Management. My name is Howard Tipton. I'm the St. Lucie County Administrator. St. Lucie County has today joined more than 40 other Florida counties with a positive coronavirus case. And for the discussion about what that means for our community, we'd like to invite Clint Sperber, the administrator for the St. Lucie County Health Department, to speak with you. So, Clint.
Thank you, Howard. Again, I am Clint Sperber. I'm the administrator for the Department of Health in St. Lucie County. We were notified by a provider late last night of a positive COVID case in a 56-year-old male living in St. Lucie County. I just spoke to him, and he's doing very well. He is currently at home self-isolating. He is extremely cooperative with our guidance. Later today, we will conduct a thorough contact investigation as part of our routine protocol. My main message for everyone is, if you are sick, stay home. If you have been in contact with anyone who has been sick, please self-monitor for symptoms. Those symptoms are cough, fever, and shortness of breath, to prevent spreading the disease to others and to protect our vulnerable population. Currently, there are 658 total cases in Florida, 603 positive Florida residents and 55 non-Florida residents. As Howard has mentioned, St. Lucie County now becomes the 41st county in the state to have a positive case. Indian River has 4 confirmed cases. Martin County has 1 confirmed case. We continue to work with our community partners. We have worked with our partners to provide extensive outreach and education to our area's assisted living facilities and nursing homes to ensure that our most vulnerable citizens are protected. The best way to protect yourself is to practice good hand hygiene. Which does include frequent hand washing, covering your mouth when you sneeze or cough, avoid touching your face, staying at home when you are sick, as mentioned before, and good surface cleaning. Also, practice social distancing. Avoid mass gatherings in groups of 10 or more people, and try to maintain a distance of 6 feet apart from other people. Limit interactions, especially if you are 65 years or older and have chronic health conditions such as compromised immunity, diabetes, or heart and lung disease. As you have read, symptoms can appear 2 to 14 days after exposure. Most people, approximately 80% of them, will experience mild to moderate symptoms, which include, again, the fever, cough, and shortness of breath. This is our concern, especially for our elder population with chronic diseases. I know that there's been a lot of questions also about testing. Testing capabilities have been absolutely ramped up by the federal and the state government to focus on areas where community transmission is taking place. We encourage residents to keep using prevention measures and monitor yourself for symptoms. If you become sick, call your healthcare provider for evaluation and to rule out other illnesses and stay home. If your healthcare provider recommends COVID testing and they are currently not available to do the testing themselves, they will refer you to a location. Currently, Cleveland Clinic and Tradition, Martin North are offering testing by appointment only. From a Department of Health standpoint, we have had constant updates on our website, and I definitely encourage you to take a look at that to find out the latest guidances. And please follow our recommendations. We have been pushing this for days and weeks, and it's very important to heed our advice.
Thank you for that, Clint. This is an emergency management operation. We are at a level 2 activation. And so I'd like to bring forward our incident commander, Ron Parrish, who's our public safety director.
Good afternoon. As Howard said, my name's Ron Parrish. I'm the public safety director here in St. Lucie County. And on September the 7th, St. Lucie County declared a local state of emergency. And the very next morning, the Department of Public Safety Emergency Management, along with the Department of Health, St. Lucie County, activated our Emergency Operations Center to a Level 2 activation. And so it's somewhat of a hybrid type of activation because we want to keep the occupancy there lower. So it's a hybrid. We're using a lot of telecommunications in order to accomplish our goals and our mission. So, Howard said it and Clint said it, and it's important for us to make sure that we're following our personal protective measures, that social distancing, that washing our hands, that staying out of large groups, very important for us. So we are continuously communicating with all of our partners in emergency management as well as our stakeholders here in St. Lucie County, as well as the State Emergency Operations Center. So that communications is wide open, and it's been working well for us. So that process works. It's the incident management system, and it works in these types of incidents. So if there's any questions, I'll be glad to take any. Thank you very much.
Can you tell us how many people in St. Lucie County have been tested for the coronavirus?
I'm going to bring Clint up.
Daily on our website, there's a dashboard, and on that dashboard, it does list all of the positive and negative tests that have been performed through our Bureau of Public Health labs. In addition, we receive lab results that are also updated through the commercial labs in the hospitals. So that information is up there.
I mean, as national entities have said, they are ramping up testing kits, but it's been showed in Martin and Indian River, the private sector has done a lot, can test many more people than a county level. How many tests are you expecting, and along with the private sector, will you be able to handle a large volume of requests?
So that's a great question. In St. Lucie County, there are several providers that are doing testing. Our hospitals are capable of doing testing, as well as us from a department standpoint. If someone comes in and we learn about if they qualify based upon the guidance that has been set forth by the CDC and Department of Health, if they qualify for testing, we will be able to test them.
Clint, you'd mentioned the dashboard a bit ago as far as information where people can find out information about the current numbers. This morning for the 11 o'clock update, it indicated the case for St. Lucie County, but on the dashboard it identified that as a female who was the patient, and earlier you mentioned it was a 56-year-old male as the patient, so I just wanted to make sure we've got the correct information.
Yeah, we can definitely get that clarified. It is a 56-year-old male.
It is male. Okay.
Yes, sir.
All right.
Is there a number or a figure for how many people have in fact been tested to date, whether at Cleveland Clinic or any other hospitals, so there, it's known as one positive out of so many tests?
I do not have a total number of people who have been tested, but I can tell you that there have been a lot of tests. And even more importantly, we do know that the virus is in the community. It is in 40 other counties, so we can imagine that it's statewide, it's national, it's across the entire world for that matter. So I think what's even more important is if you're sick, stay home, stay out of large gatherings, and that's a real message that we need to continue to move forward.
There is Cleveland Clinic in tradition is hosting tests, but I was just wondering, when Martin County first had the case, were doing private testing, St. Lucie County has a larger population than Martin County or Indian River. Why did residents have to go down to Martin County to get tested? And I was just wondering from the administrative standpoint, why did it take longer to set up here?
Well, without speaking for a Cleveland Clinic tradition, they are located in 2 counties. So they are in both counties, and they have been testing in both locations. There have been a lot of other tests that have happened in our HCA hospitals as well. So that is ongoing, as well as medical providers throughout the community. And when we learn about a case, that we are also, when I say a case, somebody who meets case definition through the health department, that we are also able to test. And testing has been opened up across the state for that matter.
I was going to ask on a different topic. This is more a Howard question, and that Governor DeSantis closed the beaches in Palm Beach County, and so any word on your thoughts on keeping the beaches open or closing them in St. Lucie County?
So that's a great question, and we are monitoring the activities on the beach. It is our desire to keep them open, but we do require everybody to maintain that social distancing that we've been talking about. And we had an incident yesterday where we ended up needing to have a greater presence at that particular beach, and we are stepping up our presence at our busiest beaches to ensure that people are reminding themselves and remembering that it's okay to be outside. You just have to be apart from everybody else, and that's just, it's important. And if we get to the point where people just aren't remembering that, then we may have to think of doing something else. But we would really prefer to keep our parks and beaches open just to give people an outdoor option as they maintain safe distance.
Yeah, Howard, to follow up on that, as far as what's recommended if, say, someone's at the beach, is it the guideline that you're looking for people not to be in groups of more than 10, or are you wanting to have people maintain 6 feet of distance?
Yeah, and so I think it's both, actually. I think we're trying to make sure that it's small groups, and that in that small group you're maintaining your own space. And the good news is we have some really wide beaches if you think about Pepper Park, and there's plenty of space to spread out. And so you just, if you're a family, obviously, and you're living in the same household, then, you can be closer together. But if it's a group of individuals from different households, then please maintain that separation. Well, one of the, as we wrap this up, there are no other status changes to anything else that we covered yesterday on our briefing, but I did want to mention one of the striking number that I read last night, and that was that the World Health Organization has shared that from the first known case, it took 3 months to achieve 100,000 cases. And then it took 12 days to achieve the second 100,000 cases. And so when we talk about slowing the spread, which is what all of these activities are about, we're trying to just slow the spread of this disease. It really is important, not just in St. Lucie County, but around the state of Florida, around our nation, and certainly around the world. And so as you talk to your friends and your family who are in likely other parts of the United States or the world, make sure you continue to emphasize that message as well. That all that we're doing is trying to make sure that we stay healthy, we keep our distance, and all of that together helps to slow the spread. It's a big deal. It makes a big difference for us.
Also, a question for you, if I could. In Hillsborough County, they've released some jail inmates. Is there any thought of doing anything like that in St. Lucie County, decreasing the population?
So our jail population right now is manageable. We know that we have to watch that. They have suspended jury trials, and so we are watching that with the court system and with our sheriff. At this point, there is no planned release above what we normally do in terms of trying to get people out on either bail or bond or on their own recognizance.
And the sheriff has limited visitation to the jails.
Yes, that's correct. Much like the hospitals, you're seeing where unless you're basically in labor, they really are limiting the visitation at the hospitals, and the sheriff has basically discontinued visitation at the jail at this time.
So with regards to the new curfews and stuff for businesses and restaurants, did you have any issues with anybody, following the new guidelines recently?
We had our calls this morning, and there were no notices of any problems with that. I think everybody was very good about following the guidelines. I mean, it's a difficult thing for the restaurants and the situations that they face, but I think everybody understands that these are extraordinary times. And again, if we can keep the restaurants open so that they can provide takeout or delivery, that allows some degree of the business to continue, and we certainly want to encourage that. Again, making sure that if you feel ill, that you stay home. And that's a big part of this message. If you feel bad and you're in a food service industry, that's not helpful. So let's just make sure if you're not feeling well, you stay home, and when you come to work, make sure that you follow all the hygiene protocols that are in place.
Follow-up question on the restaurants with the mandate that's come down from the governor. One of the comments he made yesterday regarding the going ahead and cutting off all in-store eating is that they tried the 50% capacity situation for a few days and found out that that didn't work. Was that your experience as well locally in St. Lucie County? Did you find maybe some restaurants were not abiding by the mandate? They stick to 50% of their seating for those few days while that was in place?
So in the calls that we've had, that's not been a discussion item for us, so I'm not aware of any instances where we were not seeing that level of cooperation. But I do understand, what the governor was trying to achieve. It's just difficult, and when you have maybe some areas that weren't as cooperative, it's hard to say, this area is closed and this area is not. So I understand what they were trying to do, but I'm not aware of anything in St. Lucie County.
Sorry to make you run around. I had a quick question also. I think maybe you would be more knowledgeable in this subject. Just about the case that we do have here. Do you know if it was travel related at all?
It's an ongoing investigation, and we're going to learn more about that later on today. You're welcome.
Is that it?
All right. Well, we thank you very much. Again, the big message continues to be, maintain yourself at home to the extent you can. Unless you have to get out, just hang out. And if you're looking for something to do, I can share with you that it'll only take a couple of minutes. Everybody's got the new census forms in the mail, right? It would be a great opportunity to help your community to make sure that you're filling those out and you're returning those. So that'll only take up a few minutes of your day, but it will actually be a big help to the community. The other big help is stay home as much as possible. And then if you have to go out, make sure that you're following all of the hygiene and social distancing measures. All right. So thank you for joining us here for this emergency operations update. We'll see you next time.